Welcome back, everyone. For those of you just joining us by live webcast, I'm Barb Zarnico, co-chair of the Board of Directors of the ICA. For those that have been with us since early this morning, I hope you're enjoying and learning as much as I am. I have the pleasure of introducing the speakers for our next session, A Time for Two, Intimacy, Sexuality, and IC. Jen Fariello is a nurse practitioner for female and male pelvic and sexual medicine at the Pelvic and Sexual Institute here in Philadelphia. Joining her in this morning's discussion about intimacy and IC is Dr. Sabitha Pillai-Friedman, who is a psychotherapist and certified sex therapist with more than 20 years' experience working with individuals and couples in her private practice. Please join me in welcoming them.
Good morning. Thank you for having us. So we're going to speak about intimacy, sexuality, and interstitial cystitis this morning. Up to 87% of women with IC report painful penetrative sexual activity. 54% of women with IC report avoid having sexual intimacy due to pain. This often results in decreased libido, feelings of inadequacy, isolation, and depression. 56% of men with chronic prostatitis, chronic pelvic pain syndrome, report ejaculatory or post-ejaculatory pain. So this is a prevalent problem among men and women with IC. When we manage patients with interstitial cystitis, we have to remember side effects that can occur because of the way we manage. It's also important to control symptoms of IC and comorbid conditions such as vulvodynia, pelvic floor dysfunction, and IBS before noteworthy improvement in sexual dysfunction can occur. So if we don't control the symptoms, we're not going to make much progress in establishing intimacy. People are going to avoid intimacy because of the pain that they're feeling from the IC, the pelvic floor dysfunction, or the vulvodynia. How do we do that? First, we take an accurate and detailed history and do a really good physical examination. When you come into the office, we usually do a Q-tip test for pain, identification of pelvic floor muscle tenderness, and we sometimes do an intravesical anesthetic to see if some of the pain generators are coming from the bladder. We also sometimes do a correlation of food, stress, or sexual activity triggers to also distinguish pain generators. In our treatment for IC, pharmacological treatment include agents that improve pain and other urinary symptoms, but they sometimes have untoward effects on sexual function. Some of these medications can cause decreased libido and arousal, erectile dysfunction, and orgasmic dysfunction. So once we get the pain under control, we can help stay the side effects of some of the meds. We help patients do some self-care measures before intercourse and after. Lack of education compounds the problem why people sometimes avoid intercourse. They are taught alternatives to penetrative intercourse. We teach patients that they can have oral and manual stimulation. We teach them alternatives for penetrative, such as outer course. We teach them creative thrusting, so they can have inner mammary, inner gluteal, and inner femoral play. We teach creative thrusting. Side lying, spoon position sometimes help alleviate some of the pain and pressure, both on the glands and the bladder. Angled missionary position, and we also teach circular motion. So they can eliminate the thrusting, and instead their partners move their hips around. It sometimes alleviates some of the pain and pressure. We tell patients to limit the thrusting time to 5 minutes. We tell them to use hypoallergenic, non-irritating lubricants. Consider pre-medication 15 to 20 minutes prior to any kind of activity. Pre-medication consists of urinary anesthetics such as pyridium, Urabel, Urel. Muscle relaxers, either oral Valium, or sometimes we can use Valium suppositories either rectally or vaginally. Pain relievers, or lidocaine to the vulva. We do always encourage to remember to wipe it off before the actual, any kind of sexual intercourse, or use condoms, or their partner will get numb also. They can apply ice packs before or after. When they apply ice packs, you can either apply the actual ice pack, or you can put some water in a glove or a condom, freeze it, and actually insert it into the vulva, and sometimes that'll help numb both internally and externally. Some patients dilate or use internal myofascial release prior to any kind of penetration. This helps to both desensitize the glands and relax the muscles prior to having intercourse. It's also really important to know when to triage to a member of the sex therapy team. When we treat patients with IC and the comorbid conditions, vulvodynia and pelvic floor dysfunction, multidisciplinary treatment is essential. So we can get patients better to a certain point and help decrease their pain, and we can know what to do, but then we always like to have the sex therapy team available so we can take it one step further. And with that, Sabitha is going to talk a little bit about maintaining intimacy when patients have chronic pain and they're dealing with that.
Thank you. I guess I'm wired and turned on, so I may as well speak about sexuality. The first slide, please. I usually speak in an interactive manner because I'm first of all an assistant professor at Widener University, Center for Human Sexuality Studies, and I also have a private practice. So I'm used to teaching, and I like to do a little bit of quiz with people. And some of it may seem very obvious, but I'm still curious to know what you all think. True or false, one needs to be young, pretty, or handsome, and healthy in order to enjoy sex. Great. Great students. All touching is sexual and should lead to sex. Sex equals intercourse. Good sex is spontaneous with no planning and no talking, Hollywood style. Great, wonderful. Next slide, please. You're all right. It's all false. These are all the myths that I encounter every day in my practice. You know, couples will come and tell me, you know, we've been married for 20 years. You know, we want to have spontaneous sex like we did when we first met. I try to tell them dating is one of the most planned activity. You know, we even think of what underwear we're wearing, knowing that we are kind of close to having sex. So would it happen tonight or tomorrow? We plan. So these are some of the myths I try to break in my sessions. So everyone can enjoy sex. Sex can be enjoyed by people of all ages, regardless of appearance, physical capabilities. And sex, when adapted to suit individual needs, can be fulfilling and pleasurable. Next slide, please. So I insist upon touch because most of the times when individuals and couples are dealing with a condition like pain, I also treat breast cancer survivors in my practice and other survivors of chronic illness, you know, who are coping with chronic illness. And most of them, when sexual pain comes into the picture, stop touching. Because one of my clients told me, if I sit next to my husband and watch a film, and if I put my arm on him, then it means that I'm signaling to him that I'm willing to have sex. So she says to me, she calculates and leaves exactly 12 inches between them. So at no point will her body touch his body, so he will never have to assume that anything is going to happen that night because she is having pain and she really doesn't want to go that far. So I teach couples and individuals to touch without fear, to touch and to communicate. You know, I really don't feel up to it, but I'm glad to play a little. We all played as teenagers. I mean, how many of you were, you know, made out and did things that would be considered sex play without intercourse. So I speak to them about the importance of touch, and touch in itself can be soothing, comforting, and can help one feel loved. All touching does not have to lead to sex, and just talking to couples about it can liberate them tremendously. You can sit and watch a movie and get rid of the 12 inches between the two of you, and you can cuddle during the movie, and it's okay. It'll help you feel loved, it'll help you feel connected, and it'll help you with bonding, and you don't necessarily have to do whatever is expected next. So I usually talk to couples about the importance of not equating sex with intercourse, because that is a very common belief that sex equals intercourse. My 14-year-old, she saw me doing the slide, and she said, "Mom, you're lying. Sex means intercourse. Why are you saying this?" I said, "No, actually, children of sex therapists are surprisingly not interested in talking about sex, by the way. Just want you to know." So I insist, I teach couples to look at sex in a broader context. Sex includes hugging, sensual caressing, massage, cuddling, kissing, oral, manual stimulation, use of vibrators, other sexual toys, and the wonderful technique that Jen talked about, outercourse, can be a great technique as well. And intercourse is only one part of sex. So what I ask couples to do is to do a pleasure circle, like a cycle, like a pizza with, sectors, and ask them to write down all the things that they enjoy sensually and sexually. So sometimes they would say just reading erotica together, reading a fantasy together, or they may say, "I like to just cuddle with you." So they get to pick what they want to do that evening. So each of them have their own, pleasure wheel, and they pick and choose. And the partner has the right to say, "I don't feel like it. I don't feel like, telling you, reading a poem about love today because I feel like I just want to experience mutual stimulation and go to sleep." That's okay too. So communication, having the freedom to say no without feeling guilt, is very important in a relationship. Next slide, please. See, this is a model that I developed after years of treating couples. Planning and communication about sex is really important. The myth of spontaneity is very, very hard on couples and individuals who are dealing with any kind of sexual difficulty, and also couples who are in long-term relationships. Novelty and mystery in the early dating relationship kind of erodes away. As you've been together for 30, 40 years, you've been through several stages. It's very hard not to plan and to communicate. Couples are also misled, unfortunately, by Hollywood. I still remember in the movie Ghost, one woman told me that her fantasy image was the movie Ghost, where Demi Moore is like doing, making a pottery thing, and then Patrick Swayze comes and seduces her, and then they make love. And that was her fantasy. And she said, "I don't want to plan it." And I thought to myself, well, if you don't plan it, do you have a pottery wheel in your bedroom? How are you going to make this happen? So, it's best to tell your partner, "Hey, I have this fantasy. This is exactly how I like to be seduced. Now go to town. On Saturday night, I want to be seduced like that. Can you come up with some idea of seducing me like that?" So even seducing, even coming up with a kind of a fantasy for the bedroom requires planning and communication. Because how is your partner going to know that what you want is that kind of seduction? Because her image of seduction or his image of seduction could be, Sea of Love, the scene with Ellen Barkin. that is wildly different from the other one, because this is more gentle and this is like, hardcore, immediate and fast, and there's no time. So what is your fantasy? This requires communication. So one second, could you please go back? I just have to go through them. So when you plan and communicate, it creates positive anticipation, and it also lowers anxiety, because most men come to me and tell me, I don't know what my wife wants. I don't know what my partner wants, because I know she wants something because it's Valentine's Day, but I really have no idea. I mean, I cannot tell you the number of women tell me the same thing. So creating some kind of positive anticipation, these are the parameters within which I want to be seduced. And then it also lowers your anxiety, and it creates higher level of comfort with sensual and sexual experience. So you can actually anticipate, well, this is exactly what my partner wants, so I may as well prepare by doing this. So it results in enjoyable sexual and sensual experience. It results in couples bonding, which again leads to planning and communication. Saturday nights, we can, talk to each other about fantasies and make things happen. This is great. Next slide, please. So most of the individuals who have any kind of sexual difficulty, one of the things that they need to do before they move on to eroticizing their body is mourning the loss of the former sexual body, because we all change. I'm middle-aged, so I remember in my early 20s, my sexual body was very different. So everybody's sexual body changes and evolves, but when there is pain added to it, most of the times individuals will come to me, men and women will come to me and say, I used to be able to do all of these things, and I really cannot let go. I really want that. I want that sort of spontaneity. I want that sort of prolonged intercourse, which I was able to enjoy. So it's very important for individuals to mourn the former body. It requires that you journal about it, seek the help of a therapist, discuss the loss. But there's also a new sexual body that you can welcome that performs differently, but if you can adjust to its difference, then you can enjoy it more. Next slide, please. I would also suggest that individuals and couples fantasize. Allow yourself the luxury of fantasies. There are so many wonderful books that you can purchase, videos you can watch. Sexual fantasy is the mental juice or the vibrator of the mind, says Wendy Mollison-Boss. So self-pleasuring is also a very important part of awakening your body. So you really cannot engage in couples relationship, in a relationship with your partner, before you actually awaken your own body to sexual pleasure. Next one, please. So what does self-pleasuring do? It reduces performance anxiety and response anxiety. What is performance anxiety? Performance anxiety is the anxiety one feels because they feel like they may not be able to do what is expected of their body. One male patient that I treated told me that he was afraid to take Starbucks coffee to his girlfriend because if she is in a mood, then he may not be able to perform, so he's not going to engage in this thoughtful behavior. So, that is called performance anxiety. And response anxiety is when my partner touches me and wants to engage in sex play, my body may not respond because I don't feel desire. The pain has really affected my desire. So self-pleasuring reduces performance anxiety and response anxiety because you kind of figure it out on your own. And it also helps understand your own sexual response. And it prepares you to guide your partner in sexual activity. It also primes your body for more sexual activity because people who self-pleasure experience desire and they seek more sexual activity. And above all, it's fun. So I would highly recommend self-pleasuring as the first step to a couple's relationship. Next slide. So schedule private time for yourself, and you can read erotica or watch films that arouse you, self-pleasure with hand or vibrator, and repeat as often as you can. And as long as you have privacy, this is a very fun way to spend an afternoon. Next slide, please. So I'm going to talk a little bit about couples and what are some of the tools that IC patients can use with their partners. Both partners need to learn as much as they can about IC and IC treatment and its sexual side effects, because the knowledge in and of itself will lead to communication. And then that will lead to a better understanding of each other's sexual response. So it's best to adapt your sexual style to some of the difficulties that you may be having. And it's also important to engage in external stimulation to build eroticism, like sharing sexual fantasies, acting out sexual fantasies. So all of this is built on communication. So you really have to talk about, and unless you plan to have some kind of sexual play on a specific day, you really can't, build eroticism. So I usually tell my couples who come to see me not to call it a sex date, but to just call it a play date. And so they can plan whatever they want, and they can, based on their mood, just watch a movie if that's all they want to do. But sharing fantasies could be a really good way to kind of get each other motivated. Next one, please. I also have a few other suggestions. Try a different time to be sexual. Most of the couples are, kind of challenged in terms of schedule. I like mornings, she likes night, or we don't have privacy, we have kids. So in negotiating, that could be a very good opportunity to, figure out a different kind of a strategy for sexuality. And use lubricants for comfort. And Jen talked about the products to avoid, the chemicals to avoid. Non-irritating lubricants can be very helpful. And use pillows for support. There is a company called Liberator, which sells wedges and ramps. They don't give me any. I'm not their spokesperson or anything, but I do recommend it to my clients who need support. And use a vibrator as needed, because if you're not able to pleasure your partner to orgasm, then vibrators are a very good tool to use. Share sexual fantasies, take breaks as needed. Every partner should be able to say, I don't feel like it, or I'm done, I just need a break. Can we take a break? And that sort of communication and understanding and respect is necessary in relationships. And talk about what works and what is not working. You remember the way you were scratching my ear the other day during foreplay? It doesn't work for me. I just let you do that because we were in a movie theater and I didn't want to stop you, but I just don't feel good about it. Don't do that again. So I cannot tell you the number of couples who just don't even have that basic conversation. They've been putting up with the same kind of foreplay for years, which they don't like. And use humor and be playful. When you have, when a situation is not working out, you could always use humor to kind of get rid of the tension or to deal with the tension, because if you carry the tension over, then there's going to be negative anticipation for future sexual connection. Thank you for your attention. You can ask me questions. I think that's the last slide.
I just want to remind everyone, if you have questions, just fill out a question card and pass it to one of the staff in the blue polo shirt. But we do have some questions already. Dr. Pillai-Friedman, journaling. I feel embarrassed to talk to my partner about my feelings with sex. Should I show my partner my journal to be able to communicate with him or her?
It's a wonderful idea, in my opinion. But make sure that you can write a journal for your partner. So you can have your own personal journal and then have another journal that you need to share with your partner, because you also need a space to write about your own personal feelings that you don't want your partner to read. I'm really mad at him today or her today because she has been annoying. So have a journal in which it's almost like a love letter that you write throughout your life. which is for the couple. Great idea.
Thank you for the great question. We have another question. I'm dating. When is the right time to tell my partner about my issues with IC and sex?
It's a very good question. You really do not want to say it too soon, because you're really not going to have intercourse right away. So get to know the person. Let the person know that you have so many other wonderful qualities. And IC is only part of you, and it's not your entire being. So once you come to that, it takes a while. It depends on how many times you see the person. But I would say about, 7 or 8 meetings, and perhaps, I would say about 3 months. But make sure that you enable this new person to meet you as a person. Do not allow IC to define you.
Great response. And here's a question for both of you. What is outer course?
Outer course is, I'm not going to use the medical terms that Jen used because it doesn't really roll off my mouth as it did Jen's.
Sorry.
Well, I didn't mean to. No pun intended. But it is basically, instead of using your vagina for intercourse, you use the thighs together. Place your thighs together, and encourage thrusting between thighs, between breasts, and between your buttocks. So it is basically not. Penetration can be, mimicked in different ways. I would also add one more thing to it. There is a product called Fleshlight, which can also provide the same kind of stimulation that intercourse provides, but it is, so after 5 minutes, if you want to transfer to the Fleshlight, that could also be an option.
So it's a vulva made
yes,
of.
It's a silicone vulva, and if you could buy
vagina and vulva.
Yes,
and it's actually ribbed inside that actually feels like a real vagina and a vulva.
Yes. Mm-hmm. And there are other products that are similar, right, but you can Google it and you can find more.
And we'll have a lot of the resources that all of the presenters suggest on our website, so you can take a look at where to find that if you like. We have another question from one of the attendees. When dealing with pain all day, how do I change my mindset to have sex with my husband?
It's a very good question. It does, pain that you experience all day can make you irritable. It can also make you tired. So I would suggest do some, something for yourself. Yeah. Do you agree with me?
I completely agree.
Some kind of, self-soothing activity.
A bath.
A bath.
A bath beforehand.
Mm-hmm. Mm-hmm. And perhaps just if you have some children or, you're taking care of, you could maybe take a couple of hours to just go out on your own and do something on your own for yourself.
Save some me time.
Yes.
Just take some me time.
Any other suggestions besides those?
I would suggest that while you're taking a bath, that you read some erotica. Because be in a position where your pain is not flaring up. There's always a position that where you're sitting or lying down or taking a bath when you're relatively pain-free. In a situation like that, then pull out a book and, look at some pictures, read some, women respond more to written word than visual stuff. I mean, I'm not generalizing. There could be women who enjoy films as well, but that may be a good way to get your mind turned on. Do you want to say something, Amy?
And it doesn't have to be hard erotica. It could just be 50 Shades of Grey.
Yes, I totally agree. There's a lot of romantic. A lot of women read romantic books. Way before 50 Shades became a success, women were reading the Harlequin novels, which present romance in a way that is pretty clean, but is there's so much tension and stuff that women enjoy a lot. So that could be I have a list of erotic material I usually ask my couples to read.
Great, great. We have another question. When my husband or wife have sex with me, he or she thinks that it causes me pain. How can I express that I'm actually enjoying it and it's not something I'm not enjoying?
This is where communication plays a very important role.
I was going to say that, yeah, completely agree.
I'm sorry, I don't want
to. No, go ahead. Absolutely.
Please.
Communication.
Communication is a very great tool. And, saying if you have a good communication with your partner, then you should be able to say, this feels good.
And I think this is a vicious cycle, too, that people avoid intercourse because their partners actually avoid it because they don't want to hurt the patient with IC or the patient who has pain, so their partners pull back.
Yes.
And then this starts the avoidance, and then they don't initiate either. So then the patient who's in pain, if they're having a flare, they don't initiate, and then it just becomes this vicious cycle, and there's no communication on either side.
Absolutely. Very well put. I totally agree with that.
So I think a big theme is communication, communication, communication. Okay, we have a question from the Bright Talk webinar. I can handle the pain, the bladder pain, after sex, except for I'm having ongoing UTI infections. Any suggestions?
If they are definitely documented urinary tract infections after intercourse, there's always a prophylactic antibiotic that their practitioner can provide for them to take after intercourse. Again, they would have to speak to their healthcare provider to see if they're definitely getting urinary tract infections after intercourse. But they can always ask about taking something afterwards to prevent that.
And the doctor or healthcare provider can prescribe something that's safe to take prophylactically?
Afterwards.
Okay, great. This is a great question. How do I find a local sexual counselor that specializes in IC and other chronic pain conditions?
ASECT website.
Yeah.
There's the American Association of Sex Educators, Counselors, and Therapists. The website is an acronym, ASECT, AASECT, and I will give you the resource if you would like to post it. ASECT is a certifying body for sex therapists and sex educators and counselors. So if you go to the website, you will find listings of people who specialize, who have been trained and certified in sex therapy, because you really want to go to somebody who really has a comfort level with the discussion about sexuality.
Great, and we definitely will have those resources online. How can I help my husband or wife realize that our sex life has changed because my body has changed over time due to my pelvic pain?
Go ahead.
Go ahead. No, go ahead.
Oh. We're being very polite to each other. We work in a team, so we know each other very well. Well, I think, again, it comes down to communication and also being able to be playful with each other. Because, in long-term relationships, novelty and mystery kind of erodes slowly. So bringing in new activities and, talking to your partner about your body. My body is not the same, so I can't do what I was doing before, but I can do a lot of other things too. So introduce some novelty into your sex life while you're talking about things that have changed. So some of the ideas that I gave you before may be ideas that you may want to use.
Great, great. And I know this was mentioned in the talk, but we have a lot of questions about this. What types of medications can I take prior to intercourse to decrease the amount of pain I experience during?
If it's pain, if it's vulvar pain, we usually recommend, again, putting on some lidocaine prior. Again, wiping it off before or using a condom, because if the partner gets numb, the partner will keep going and going and going because he's numb too. And then that can prove to be more painful later. So if it's bladder-based pain, we sometimes recommend some urinary anesthetic, like a pyridium or a Urabel, whichever works better for the patient. If it is pelvic floor muscle pain and the pelvic floor muscles are spasming, then we either recommend some kind of a muscle relaxer, Valium by mouth, Valium suppositories. If you're going to use it beforehand, usually rectally, so it's not all messy. If you're going to use it afterwards and you realize that your muscles tighten up afterwards, then you can use it vaginally afterwards.
Great, great. We have another question about UTIs. Is it true that urinating after intercourse helps to prevent UTIs?
A lot of people do that. I don't believe that there's literature that actually supports that actually shows that does anything.
Okay.
I mean, people do, and if it makes them feel better, that's okay, but I don't believe that the literature supports that.
Okay, so that's when a prophylactic antibiotic might be best to use.
Correct.
Okay.
Correct.
Great, great. Thank you. What can I do for the pain I get after intercourse that lasts for weeks?
So if the pain lasts for weeks, a lot of times if patients go into a flare because of intercourse, we will bring them in, we'll put some, if it's bladder-based, we'll put anesthetic into their bladder, try to calm their bladder down. Again, they can take some urinary analgesics. A lot of times that's what we will recommend. If it's pelvic floor related, again, we'll try to treat their pelvic floor with a muscle relaxant, or they'll go see their physical therapist,
Okay.
do some stretching. If they're having a vulvar flare, we'll either switch some of their creams or have them use their creams a little bit more, suggest some baths once a day, try to calm everything down, put something in the bath water to try to calm things down. It really depends on where the pain is coming from, what's flaring, what the pain generator is.
Okay, thank you for your response. And we have a question about the list of erotica books. We can post that on our website. You'll have a list of that.
I'll email it to you.
Okay, great. So we'll have that on the website. What is reading erotica? Is a question from our online audience.
It is reading books that arouse you. So it could be romance novels. It could be soft core material like 50 Shades of Grey, or it could be hardcore. It depends on your taste and your interest and your tolerance. So, most of the times I try to meet men and women where they are. What are they comfortable with, and then I suggest material accordingly.
Great. So everyone is different what they see as erotica.
Absolutely. I actually once treated a woman who told me, I don't want any erotica that is bad writing. She told me that I am a literature major and I like good writing. So I did my research. D.H. Lawrence, Lady Chatterley's Lover. He wrote it at the turn of the century, and I'm telling you, it's pretty hot.
So we'll make sure that one's on the list.
Yes.
Okay. Here's a popular question from the audience. My wife does not pleasure herself. I ask what she enjoys, but she still has issues identifying techniques. How can I learn what she enjoys if she cannot tell herself?
She may benefit from a little bit of work with a sex therapist who may be able to liberate her, because sometimes it's permission giving, and sometimes when women are raised in very traditional, men and women who are raised in very traditional families have a very hard time giving themselves permission to pleasure themselves. So that requires a little bit of work with somebody who can meet them where they are and give them permission and give them material that's not too threatening. So this is where I will start with something very low key like one of the Harlequin books.
Okay. Thank you for your response.
There's somebody who has.
If you just write it on the card, then I can take it next. Okay, here's a question from the online audience. Do you have any recommendations for me? I get a bladder infection every single time with intercourse. I know you mentioned prophylactic antibiotics. How about washing beforehand and afterhand? Would that help?
Again, we'd have to make sure that it's definitely a urinary tract infection. So the first thing to do is to get a culture to make sure that it's a documented urinary tract infection, to see the organism, the susceptibilities. There's a whole bunch that goes into recurrent urinary tract infections every single time with intercourse. And then the best thing, if it definitely is probably a prophylactic antibiotic afterwards.
Right, because the symptoms of IC often mimic
Correct.
UTI.
Absolutely. That's exactly why we recommend getting a culture, just to make sure. Exactly.
Great, thank you. This person has latex allergies and IC. How can they avoid products that have that chemical? For instance, condoms, would there be other types of condoms besides latex?
Yeah, there's also a polyurethane. Avanti brand is a polyurethane condom that we recommend a lot. Is there another one that you do?
I think yes, and if you go online and look up latex-free products like condoms, you will find there are a lot of condoms that are latex-free now because of that many people have latex allergy.
Great, thank you. A gynecologist on Dr. Oz recommended a silicone-based lubricant as it worked better than water-based and aloe-based lubricants. Is that okay for IC patients?
Silicone?
Yeah.
Yes.
Yes. Fine.
So again, it's just individualized.
Yeah.
Not
it
everything
lasts longer.
works.
Silicone-based lubricants usually last longer, so it could be useful for IC patients.
The main things you really want to stay away from are things like additives in any of the lubes. Propylene glycol, alcohol-based. If you see those on the labels, you want to stay away from that.
I usually tell women, one of the things to consider is anything that's warming, cooling.
Menthol.
Yes.
Stay away from menthol.
Those, stay away from them. I usually, I give talks at breast cancer conferences. I go to the display section and I make them remove all the warming, cooling stuff because I say this is not something they should be using, so take it off the shelf. So yes, just plain old, no fragrance lubes are the best.
Great response. Okay, here's another question from our online audience. Is there any way to combat a mental block of not wanting sex for the sake of pain afterwards and not feeling like it is worth the effort or recovery afterwards?
It's a very good question. Many couples talk about this. Individuals talk about this, that they have this block because they connect sex with pain. And so it's very hard for them to break the connection between sex and pain. And so avoidance becomes their tool. And here's where is, communication. Self-pleasuring can be extremely useful here because you can decide that you want to, how much time you want to spend self-pleasuring. You can decide what pressure feels right or wrong. So you can overcome this, avoidance by, kind of getting in touch with your own sexual body and knowing what feels right and what doesn't feel right. So you can then communicate that to your partner. So you do not have to then avoid because of the fear of pain. Anything to add to it?
I think also once patients start feeling better and they start getting to that place where they, I want to try to have intercourse or some kind of sexual activity with my partner, to know that it's okay to just try for 3 to 5 minutes, and they don't have to have this session that lasts for like an hour or something, because then they are going to be in pain and then they're going to avoid it the next time. So I think setting realistic goals and just being realistic about the whole experience, and again communicating with your partner saying, this isn't going to be like it was when we were 18, or not going to last for hours and hours. And I think that that's something that they also have to realize too.
It's a great answer.
Thank you. So I know we talked about antibiotics after intercourse. How can I control my symptoms of yeast infections if I'm often getting those after intercourse?
A lot of times after intercourse, if people have vulvodynia, sometimes their symptoms, just like IC, may flare or be a little bit heightened. A lot of times those symptoms can mimic symptoms of a yeast infection. It is not uncommon for people to, when they come to our office, to have seen 5 to 7 different providers before they get to us and have been treated for yeast infections for years, and they didn't really have yeast infections. Again, it's very important to go see somebody to make sure that there is yeast there every time. If they're getting yeast after intercourse every time, you have to make sure that it's yeast and it's not a flare of their glands. Because if it's a flare of their glands, we put ice on there, we have them use their creams, we have them sit in a bath with some Aveeno or some sea salt to calm everything down. But we don't just randomly keep giving antifungals every single time after intercourse, because it's not really going to help the problem if it's really this vulvodynia problem.
Great. So again, go to your healthcare provider to make sure you really have that diagnosis. And
especially if it's a recurrent problem every time after intercourse, yeah.
Okay, thank you. I do have a question. How does an IC patient find such a great team like you to work with their physical problems with IC and then their psychological issues with IC and the other conditions?
We're really lucky. Dr. Whitmore has established this phenomenal multidisciplinary approach where we work with phenomenal sex therapists. We have this great referral system. We work with incredible physical therapists, and we really have brought it together to work with we take care of the patient from this entire person aspect. We're really lucky to work with such great people.
Yes.
So.
I absolutely second that, and I think every city should have a wonderful team like this. We learn a lot from each other.
We do.
Which is wonderful, because it's a wonderful network of people, and we all know each other personally and professionally, and it really makes for a wonderful team, and it benefits the patients.
Thank you. And I guess that stresses the point that I see we really need to have a multidisciplinary approach to managing and treating your IC.
Could you take some more audience questions instead of all those online questions? That's not really fair to the people present in the room.
Okay, we have time for one more question. How can I get my boyfriend or girlfriend to understand that the myths of sex are just that, myths?
It requires, bring them to one of my talks. Have them watch this video, perhaps. There are some books written by certain sex therapists that actually talk about these myths. Barry McCarthy is a sex therapist who's written several books, and he is probably one of the more low-key sex therapists, and I really appreciate his conceptualization of sex as a broad sensual, aspect in life, and not, what is being portrayed in the media usually. So I think reading good, research-based material on sexuality could be useful. I mean, that could also enable one to demystify these myths.
I always think it's a good idea for them to go to, when they go to see a sex therapist, to
Yes.
go together also.
Yes.
I think
yes.
that's, especially if they're going for chronic pain issues or,
Yes.
in sex therapy, to have, if they need a couple sessions by themselves first, but then to even bring their partner with them to a few sessions. I think that that's a great idea.
Yes. And, one of the most common myths is about intercourse, and I usually have them come in together and I, talk to them together.
Great. Thank you for all of your questions and all of your responses.